Is it safe to see the doctor right now? You guys have asked me that a lot. And of course, I'm a doctor, so I had to weigh in on this. I couldn't just sit this one out. Guys, I'm going to jump right in with some answers, and then I'm going to talk to you about what my office is doing to keep patients safe. I would say if you are the parent of a child and you're wondering if you should take your child to their well checks with their pediatrician, I say yes, please go. Children need their vaccines, they need their milestone checks, all that good stuff to make sure that they're developing properly. The American Academy of Pediatrics, along with the CDC and so many organizations, have really amazing guidelines that pediatricians are putting into effect to keep you, your child, your family safe. If you have any questions about what they're doing and if it is safe, call your pediatrician's office up. Just call them and say, hey, should I be coming in? Should I bring my child in? Yada, yada. Okay, so that's one thing I have to say. For my adults, I'm a family physician. I see mostly adults, actually. I think at least for where I am in the country, I'm in South Jersey right now, we're doing some telemedicine, but for many of my patients, it's okay for them to come into the office to see me with protective measures put in place. Now, whether it's okay for you to see your doctor, I think depends on a number of things. The rate of transmission of coronavirus in your local area, what kind of protective measures your doctor is putting in place, your underlying health conditions. So there may be variations that your doctor does, but first thing I want you to know is you need to call your doctor to make sure that they also agree it's okay for you to come in and what advice they would suggest, and they can also tell you what they're doing. So let me give you a quick rundown about what's happening in my office, which is kind of exciting. First of all, there is no waiting room anymore. We don't want potential spread of coronavirus in a waiting room. So what happens when you pull up to my office is actually my staff gives you a call when you're literally in your car. So you get to be chilling in your car on your phone. My staff asks you all the sort of questions, your insurance information, your phone number, all that stuff. It goes through all sort of the rooming stuff that we can do on the phone. They do that there. My staff then goes outside to your car, does a temperature check, etc. Make sure you're wearing your masks and stuff, and then brings you in one by one only when it's time. So you're not sitting in our office for like hours and stuff waiting. Okay, well, I'm not that late. I don't run that late. I don't run hours late. But so you're not sitting in the office waiting and waiting and waiting. We only bring you in when you're up next. And then we also limit the number of people that come with you. Okay, so we don't allow whole families to come like we used to. So we usually have only one person or another person if that person needs a caregiver, which sometimes happens. You wear your mask through the whole visit. I come in and try to be as quick as possible. In fact, as the doctor, I try to do a lot of my research and looking at records outside the visit so that when I come into you, I'm spending the shortest amount of time possible with you, for you and for me. And I come in looking like Darth Vader. I got my N95 mask. I've got my surgical mask on top of it. I've got then a face shield. I've got scrubs on. I've got a gown. I'm wearing gloves. And we try to do things very, very safely. Then we get you out. Now, we have designated entrances and exits for our patients nowadays. You can't come through any door. We've got specific doorways that you go in and go out, and we try to keep that streamlined. There are also other things my office is doing. I just don't know all of them because I'm running around seeing patients and in my office and stuff like that. But just know that all of us doctors, no matter where we are in the country, have put a lot of time and energy into trying to make it safe for you. What we don't want is for emergency care to be delayed. We think that there's probably a number of heart attacks and strokes that have been had at home instead of in a hospital, or at least gotten care in a hospital, because people have been afraid to go. If it's an emergency, you go to the emergency room. Do not delay, do not hesitate. And as for your doctor, make sure you call us up and just ask us, what's going to be best for me? What are you doing to keep me safe? And also, many doctors are still doing telemedicine like I am. So if you're still not comfortable, that's an option for many of us. The point is, we want to make sure that you're getting the care that you need as safely as you deserve. Guys, I know I sound like an advertisement, don't I? Well, I don't mean to, but it's something you guys ask me all the time, and I want you to know that we're trying to make it happen. Of course, it's different in every part of the country. Guys, I'm Dr. Jen Caudle. You guys know that I do daily health videos, so if you're interested in daily health content, please like and follow my page. If you're interested in sending stars, I answer your questions first, guys. I'll see you soon.